Hello everyone, and welcome back to our channel. Today, we're going to talk about a topic that affects millions of people worldwide, Alzheimer's disease. It's a subject that can feel overwhelming, but understanding it is the first step toward managing it and finding hope. So, let's break it down together, from what's happening in the brain to the early signs to look for and the treatments that can make a real difference. First, what exactly is Alzheimer's disease? It's not just simple forgetfulness that comes with age. It's a progressive brain disorder that gradually affects memory, thinking skills, and eventually, the ability to carry out even the simplest tasks. It's the most common cause of dementia, and it creates significant challenges for patients, their families, and caregivers. To really understand Alzheimer's, we need to look at what's happening inside the brain. Imagine your brain as a bustling city with billions of nerve cells, or neurons, constantly communicating. In Alzheimer's, two troublemakers show up and disrupt the city. The first is a protein called beta-amyloid, which clumps together to form what we call plaques. These plaques build up between neurons and act like roadblocks, interfering with the communication signals. The second culprit is another protein called tau. Normally, tau helps maintain the structure of the transport system inside our neurons. But in Alzheimer's, tau twists into abnormal tangles. Think of it like the support beams of a building collapsing. When these tangles form, the neuron's internal transport system breaks down, and eventually, the cell itself dies. These changes don't happen all at once. They typically start in the hippocampus, the part of your brain that's crucial for forming new memories. That's why one of the very first signs of Alzheimer's is trouble remembering recent events. As the disease progresses, these plaques and tangles spread to other areas of the brain, affecting functions like language, reasoning, and problem solving. This progressive damage is what leads to the worsening of symptoms over time. It also triggers inflammation and other issues, like a shortage of important brain chemicals, all contributing to the cognitive decline we see. So, how do you spot the early signs? It's important to know that Alzheimer's begins very subtly, and it's easy to mistake its symptoms for normal signs of aging. But there's a key difference. Alzheimer's symptoms are persistent. They get worse over time, and they start to interfere with daily life. The most common early symptom is memory loss that disrupts daily life. This isn't about forgetting where you put your keys once in a while. It's more like asking the same questions over and over, forgetting important dates or events, or relying heavily on memory aids for things you used to handle easily. You might forget a conversation you just had or struggle to recall newly learned information. But it's not just about memory. Other early cognitive signs can include difficulty with planning or solving problems. Maybe following a familiar recipe suddenly becomes a challenge, or managing a monthly budget feels overwhelming. You might find it hard to complete familiar tasks at home or work. Another sign is confusion with time or place. Someone might lose track of the date, the season, or even where they are. Language problems can also appear early on. This could be trouble finding the right word, calling things by the wrong name, or stopping mid-conversation without knowing how to continue. Poor judgment is another red flag. For instance, someone might make uncharacteristic financial decisions or pay less attention to their personal grooming. Beyond these cognitive changes, it's also common to see shifts in mood and personality. A person in the early stages might become more anxious, depressed, apathetic, or easily irritable. They might withdraw from hobbies or social activities they once enjoyed. These emotional changes can be very distressing for both the individual and their loved ones. As Alzheimer's progresses into the moderate stage, the symptoms become more pronounced. Memory loss deepens, and it may start to affect long-term memories. A person might not recognize family members or close friends. Navigating familiar places, like their own neighborhood, can become impossible. Behavioral symptoms can also emerge, such as agitation, aggression, paranoia, or even hallucinations. Sleep patterns are often disrupted, which can be very challenging for caregivers. In the late, or severe, stage of Alzheimer's, the impact is profound. Individuals lose the ability to communicate, respond to their environment, and perform basic self-care activities like eating or dressing. They become completely dependent on others for their care. Mobility is greatly reduced, and they become more vulnerable to other health problems. This stage highlights the devastating nature of the disease and the immense need for compassionate, round-the-clock care. Now, let's talk about treatment. It's crucial to understand that right now, there is no cure for Alzheimer's disease. However, there are treatments available that can help manage symptoms, slow down their progression, and significantly improve quality of life. The goal is to maximize function and maintain independence for as long as possible. On the medication front, there are two main types of drugs commonly prescribed. The first group is called cholinesterase inhibitors. These medications work by boosting the levels of a brain chemical involved in memory and attention. They can help temporarily improve or stabilize cognitive symptoms in some people with mild to moderate Alzheimer's. The second type is an NMDA receptor antagonist, which helps regulate another brain chemical, glutamate. This can help protect brain cells from damage and is often used in the moderate to severe stages. While these drugs don't stop the underlying disease process, they can provide meaningful benefits for a period of time. But treatment is about so much more than just medication. Non-pharmacological approaches are absolutely vital for comprehensive Alzheimer's care. These are strategies and therapies that help manage symptoms without drugs. For example, cognitive stimulation, like puzzles, games, and engaging activities, can help keep the mind active. Regular physical exercise is also incredibly beneficial. It supports brain health and can improve mood and sleep. Creating a structured, predictable daily routine can reduce confusion and anxiety. A calm and safe environment is also key. Simple modifications at home, like removing tripping hazards and using clear labels, can enhance safety and promote independence. Social engagement is just as important. Encouraging participation in social activities or spending time with loved ones helps preserve emotional well-being and fights feelings of isolation. And we can't talk about Alzheimer's care without talking about the caregivers. Caring for someone with Alzheimer's is an incredibly demanding role, both emotionally and physically. Caregiver education and support are essential. Support groups, counseling, and respite care can help caregivers manage stress, avoid burnout, and provide the best possible care for their loved one. If you are a caregiver, please remember that your well-being matters too. This brings me to a really important point: the power of early diagnosis. Getting a diagnosis as soon as symptoms appear can make a world of difference. It allows for treatment to begin sooner, which can help preserve cognitive function for longer. It gives the person and their family time to plan for the future, make legal and financial arrangements, and decide on long-term care preferences. An early diagnosis also opens the door to participating in clinical trials, which are crucial for developing new and better treatments. If you notice any of the early signs we discussed in yourself or a loved one, please don't dismiss them. Talk to a doctor. Alzheimer's disease is a complex and challenging journey. There's no doubt about that, but there is also hope. Scientists are working tirelessly to understand the disease better and to develop new therapies that can slow, stop, or even prevent it. Research into biomarkers, immunotherapies, and other novel approaches is moving forward every day. For now, the cornerstones of effective Alzheimer's management are early recognition, a combination of medical and non-medical treatments, and a strong, compassionate support system for both the patient and their caregivers. By raising awareness and fostering understanding, we can all contribute to a community that better supports those affected by this disease. Thank you so much for watching and for taking the time to learn about this important topic. If this video was helpful, please give it a thumbs up and share it with others. And don't forget to subscribe for more content on health and wellness. Take care, and we'll see you in the next video.